If you are over the age of 65, you have likely experienced a deeply frustrating, silent issue that people rarely discuss openly at family dinners. You might wake up in the dead of night to a sudden hacking cough, even though you aren't sick with a cold, or perhaps you notice that taking a single sip of plain water during lunch triggers a prolonged coughing fit that leaves you red-faced and gasping for air. Your family might write it off as a normal sign of aging, while a primary care doctor looks over your clear chest x-ray, shrugs, and simply suggests picking up some over-the-counter cough drops. In that exact moment, millions of seniors make a dangerous mistake. They begin mindlessly masking the issue with standard cough syrups designed to numb the brain's coughing reflex. But here is the critical warning you will almost never hear during a routine 15-minute checkup. After 65, a persistent cough triggered by swallowing food or liquids is almost never a problem with your lungs or a stubborn virus. Instead, it is a highly specific biological distress signal pointing directly to a hidden breakdown in the neurological coordination between your brainstem and the delicate muscles protecting your airway. To understand exactly why this coordination begins to fracture, we have to look at the incredibly complex mechanics of a single human swallow. When you are younger, your body performs this movement thousands of times a day without you ever giving it a conscious thought. Medical textbooks describe swallowing not as a passive drop of food down a tube, but as a highly synchronized, high-speed kinetic event. In less than 1 second, your brainstem must coordinate over 25 separate pairs of muscles in your mouth, pharynx, and esophagus. The moment a liquid or a piece of chewed food passes the back of your tongue, a rapid-fire sequence must occur. Your soft palate elevates to seal off your nasal passage, your vocal cords tightly close together, and a specialized cartilage flap called the epiglottis swings downward like a heavy vault door to completely seal off your trachea, or windpipe. This temporary physical barrier forces whatever you are consuming to bypass your lungs entirely and enter the esophagus instead. It is a biological absolute. Your body must completely shut down your breathing pathway for a fraction of a second every time you swallow to ensure that not a single drop of liquid enters your respiratory tract. As you cross into your late 60s and 70s, a subtle but highly impactful transformation takes place inside this swallowing mechanism, a condition known in geriatric medicine as presbyphagia. This is the medical term for the healthy, age-related changes in your swallowing architecture, and it happens to everyone to some degree, even if you are in peak physical shape. First, there is a natural, progressive loss of muscle mass and tone in the tongue and pharynx, which reduces the sheer physical driving force available to push food and fluids cleanly down into the esophagus. Second, and far more critically, the neurological sensory processing inside your throat slows down. The microscopic nerve endings that detect the physical presence of a liquid bolus at the back of your mouth take just a fraction of a second longer to send that message to your brainstem. Because that sensory signal is delayed, the motor command to swing the epiglottis closed is also delayed. That tiny millisecond lag creates a brief, dangerous window of time where the vault door to your lungs remains wide open while a liquid is already rushing past it. When that biological vault door closes even a millisecond too late, a tiny droplet of fluid can easily slip past the epiglottis and drop down into your trachea. This specific event is called aspiration, the moment that foreign liquid makes physical contact with the highly sensitive nerve endings lining your upper airway. It triggers a massive, violent defensive explosion, a coughing fit. This sudden cough is your body's emergency override system, acting like a built-in vacuum cleaner to forcefully eject the invading fluid before it can travel deeper into your lungs. If you are coughing every time you take a rapid sip of water, your body is loudly telling you that its primary defense mechanism, the timely closing of the epiglottis, is beginning to fail, and it is forced to rely on its secondary emergency backup plan just to keep you from choking. The great danger here is that over-the-counter cough suppressants actively deaden these protective nerves. By taking a pill to silence the cough, you aren't fixing the coordination problem. You are simply turning off the smoke alarm while the fire continues to spread. If you continue to suppress this protective reflex or simply ignore the warning signs, that invading fluid will eventually travel past your vocal cords and settle deep inside the lower lobes of your respiratory tract. This sets the stage for one of the most dangerous clinical conditions an older adult can face: aspiration pneumonia. Unlike standard pneumonia, which is typically caused by inhaling airborne viruses or bacteria from a cough or sneeze, aspiration pneumonia occurs because foreign material, like acidic stomach contents, bacteria-laden saliva, or particles of food and drink, becomes physically trapped inside the delicate, moist air sacs of your lungs. Once there, these foreign substances cause immediate chemical irritation and trigger a profound, localized inflammatory response. For a younger adult with highly resilient lung tissue and a powerful immune system, a minor bout of aspiration might cause a few minutes of discomfort. But for an adult over 65, this silent pooling of fluid can rapidly evolve into a severe, life-threatening infection that can compromise your lung capacity and permanently damage your respiratory health. The clinical reality of aspiration pneumonia in older adults is exceptionally serious, carrying a hospital mortality rate that can approach 30% depending on a patient's overall frailty and how quickly the infection is identified. What makes this condition incredibly deceptive is that it frequently lacks the classic textbook symptoms of standard lung infections. A 72-year-old suffering from aspiration-driven lung strain might never run a high fever, and they might not produce thick, colorful sputum. Instead, the symptoms show up as subtle, systemic changes. A sudden onset of mild confusion, unexplained physical fatigue, a loss of appetite, or a slight persistent drop in baseline oxygen saturation that makes them feel unusually winded while performing basic daily activities. Because these signs are so vague, families often assume their loved one is just having a slow week, allowing the silent localized inflammation to quietly advance deep within the lung tissue before anyone realizes a medical intervention is required. To make matters more complex, this breakdown in swallowing coordination is frequently accelerated by the very medication seniors take every single day for entirely unrelated health issues. There are two specific categories of pharmaceuticals that geriatricians immediately look at when an older adult complains of a persistent cough during meals. The first category includes common blood pressure medications, particularly a class known as ACE inhibitors. These drugs are notorious for causing a chronic, dry cough as a side effect because they cause a natural compound called bradykinin to accumulate in the respiratory tract, making the airway incredibly hypersensitive. The second, and far more dangerous category, includes drugs that cause dry mouth or drowsiness, such as muscle relaxants, sleep aids, and certain nerve pain medications. When a medication dries out your saliva, it removes the natural lubrication your throat needs to smoothly glide a bolus of food downward. Furthermore, any pill that induces mild sedation or muscle relaxation directly slows down the neurological response time of your brainstem, widening that dangerous millisecond gap where your airway is left completely unprotected. Identifying this subtle breakdown before it turns into a serious medical crisis requires looking beyond your throat and paying close attention to your daily vocal quality. One of the most accurate yet heavily overlooked indicators of silent aspiration is a phenomenon known in speech-language pathology as a wet or gurgly voice. If you notice that your voice sounds unusually thick, raspy, or damp immediately after taking a few sips of a beverage, as if you are trying to speak through a layer of water, it means fluid has successfully bypassed your epiglottis and is currently sitting directly on top of your vocal cords. Your body hasn't triggered a massive coughing fit to clear it yet, but the fluid is actively pooling in the danger zone. When you combine this wet vocal quality with a pattern of needing to clear your throat multiple times during a meal, or feeling like food is constantly getting stuck halfway down, you are looking at clear clinical evidence that your swallowing mechanism requires targeted, proactive intervention. Fortunately, the brainstem and the muscles involved in the swallowing mechanism possess a remarkable degree of neuromuscular plasticity, meaning they can be systematically retrained and strengthened at any age. In the field of speech-language pathology, specialized throat exercises are used to directly address presbyphagia and close that dangerous millisecond gap. One of the most clinically validated movements is called the shaker exercise. To perform it, you lie flat on your back on a firm bed or yoga mat without a pillow. Keeping your shoulders pinned flat to the ground, you lift your head up high enough so that you can look down at your toes, holding that position for 30 seconds before lowering back down. This specific movement targets and strengthens the suprahyoid muscles located directly under your jaw. As these muscles grow stronger, they physically pull the entire larynx upward and forward during a swallow, which fundamentally assists the epiglottis in swinging shut quickly and completely, sealing off your airway well before any liquid can rush past. Alongside physical conditioning, making small adjustments to your daily physical posture can instantly reduce your risk of aspiration by up to 50%. The most immediate change you can implement today is a technique known as the chin tuck. When you are drinking a beverage, do not tilt your head back to let the liquid rush down your throat. Instead, sit completely upright, bring the glass to your lips, and tuck your chin downward toward your chest, right as you swallow. This simple structural shift physically alters the anatomy of your throat, narrowing the entrance to your airway while widening the opening to your esophagus, making it mechanically difficult for fluid to enter your lungs.